Right, good morning, everyone. I'm sorry about that. It's a bit of a technical problem. Thank you so much for joining us today. Today, we're going to be talking about the Survivors Trust NHS project, which we're really excited about. It's going to be helping practitioners and survivors of sexual abuse better access medical care, which is obviously really important and is an increasing issue that we're hearing from survivors every day. Can be very difficult for them and present lots of challenges. So we're going to be telling you a bit today about our research and our campaign to help tackle this. We'd love to hear from you. If you have any questions, please put your questions in the Q&A box at the bottom of your screen. Nobody else can see them, but our colleague Kate will send them our way. And if we run out of time, I know we started a bit late, so I do apologise, maybe we can go on a little bit longer. We will try and answer those questions on social media or privately if you give us your email address afterwards. So do participate because we really want to hear from you, so thank you. My name's Lucy. I'm the London Training Manager for the Survivors Trust, and I'm heading up this project. So I'm just solely working on this project, which is really, really exciting. And I'm going to pass you over to Claudia, who's also working with me, and she's going to introduce herself.
Hi everyone, thank you for joining us. My name is Claudia Williams. I'm the Development Officer here at the Survivors Trust. So I help with the planning and day-to-day management of various projects, including this NHS one of Lucy.
Great, thanks Claudia. Okay, so our NHS project, we've been asked by NHS London to address the impact that survivors have when accessing medical care. Now, any of you who have worked with anyone or are a survivor of sexual abuse themselves or know anyone will know that anyone who has had that terrible experience quite often has additional healthcare needs. It's very, very common that survivors of sexual abuse have most common is the limited immune system, particularly for survivors of childhood sexual abuse, because while their system was developing, they had a damaged immune system, and this can lead to all sorts of problems in later life. We also know that survivors of sexual abuse of any kind are also much more likely to experience cancer, heart disease, diabetes, and immune suppressant disorders. Women who have been abused are also much more likely to have complications in pregnancy. They're more likely to have uterine tract infections, and they're at higher risk of preterm birth. All of this means that survivors of abuse need much more medical care. So not only do they have issues attending healthcare problems, but they're going to need to attend it a lot more often. And this can often be quite misunderstood. It can feel very confusing that you've been through such an awful experience and now you have all these healthcare problems, but quite often we overlook that they are linked. So that's the starting point with this. The next thing is we are told by survivors every day here at the Survivors Trust how difficult they find attending medical appointments, particularly going to the dentist, going to a physiotherapist, having checks for cancer, having any sort of invasive procedure. It can be extremely triggering and it can bring back memories of the abuse. The main reason for this is just the power dynamic. Obviously, you're talking to a doctor or a nurse who has a lot more knowledge and information than you, and however kind and understanding the doctors and nurses are, because they so often are, it can still feel very vulnerable. And we know that whether you're a survivor or not, attending any medical appointment can make you feel very vulnerable. And that can be quite triggering for a survivor of abuse. They might feel uncomfortable with the procedure and the physical touching. They might not feel comfortable in disclosing what's happened to them. They might have anxiety that prevents them from speaking out or even prevents them from attending appointments. Recent research has shown that because of this, many survivors actively don't go to medical appointments, and that's particularly the case for smear tests and going to the dentist. And obviously by avoiding these appointments, which are so crucial in preventing longer term health problems, then they can become very ill later on. So we really want to work with both survivors and practitioners to try and break down this problem and try and encourage survivors to feel more comfortable in attending their appointments. And our research so far has shown us that it is just as simple as just being prepared for the medical appointments and understanding a little bit more about what's going to happen, and letting the practitioner know to just take their time. We know how busy practitioners are and how difficult that can be, but just explaining the procedure before it happens and being aware that something that they do every day can actually be quite upsetting for the patient. Something as simple as a touch on the shoulder can be quite triggering if you didn't know it was coming. So we just want to encourage practitioners to explain whenever they're going to touch the patient. And we want the patient to feel empowered to say, actually, this is causing me a bit of anxiety, or can you tell me what you're going to do? And that's the basis of our campaign. It's called Check With Me First, because we want to encourage people to check with them first before they do any procedure or touch with them. And to start it off, we'll obviously, in the pandemic, we're having to do all this remotely as well. So we've changed a lot of how we're going to deliver this training, which we'll explain to you. But we ran some focus groups with some practitioners, which was really, really helpful. And we heard from midwives and gynecologists and psychiatrists and nurses and safeguarding experts who are already working in the NHS. And we heard how their experience of working with survivors of sexual abuse. Claudia, do you want to tell us a little bit about that?
Yeah, it was really, really interesting to hear their perspective. And we learned that actually, you know, there are really stringent safeguarding measures put in place at all of the NHS trusts that we spoke to. The problem is that kept coming up again and again is that practitioners don't always have the confidence to engage with survivors, and you know, that they worry about the repercussions, they worry about the workload, and also the fact that, you know, these practitioners are seeing patients for a very short space of time, and they may not ever get a follow-up if they do raise a safeguarding concern. So confidence was a big one that came up, as were concerns about disclosure, and what to do if a patient does disclose, whether or not it's their responsibility to try and encourage patients to disclose. And these are all themes that we hope to address in our campaign.
Yeah, I think the safeguarding referral is a really important one, because people hear sexual assault or sexual abuse and they think they immediately need to do a safeguarding referral, and that can be very off-putting. It's a lot of work. Of course, you absolutely do if that person is still at risk now. But we're also talking about abuse that happened 20, 30 years ago, where the perpetrator is no longer a risk, but we know that the scars of that abuse live on for the rest of your life. We also know that when you've experienced any form of sexual assault, on average, it takes about 25 years to be able to disclose that. So if you were abused as a child, you will still be living with this trauma as an adult and still be finding it very difficult to go to medical appointments. And we also know that some survivors of sexual assault may not think that it's a problem until they go to a medical appointment. And this came up in research recently done by King's College London, which was really interesting about women giving birth. Some women didn't even remember they'd been sexually abused at all until they were in labour. And the being so vulnerable, having pain, obviously in that area, was all really triggering for them, and that they were plagued with flashbacks during their labour, which was really, really traumatic, and they were unable to say it. It's really hard to plan for something like that, because obviously, however well meaning and trained the practitioner is, you can't possibly plan for that event or for every trigger for every survivor, because it's all so unique. But it's just being aware, I suppose. And what we're really trying to do as well is encourage survivors to think a little bit harder before they attend their appointments, if that might come up for them, and to try and plan for it. And here at the Survivors Trust, we're here to help you do that as well. We have our helpline, and we have specialist services. We help specialist services all around the country provide support to anyone who's experienced sexual assault. So we provide that specialist support as well. So that's something we can do.
Lucy, I know you mentioned how common it is for people who are going into labour, you know, getting flashbacks of abuse. But one thing that really struck me joining this project is there are other appointments that people might not even necessarily think are triggering, such as dental appointments, if you're not a survivor, you might not realise how difficult those are to attend. So one thing that kept coming up in our focus groups as well is that there are a lot of, you know, checking and trauma-informed healthcare is quite common on maternity wards, but it's less common in areas like dentistry, physiotherapy, just because you wouldn't necessarily expect those appointments to be a trigger.
Absolutely. Our member agencies actually tell us that dentists and physiotherapists are the worst appointments and the ones that are most often avoided, which I was quite surprised at myself. But obviously, when you think about it, it makes perfect sense. I mean, the dentist particularly, you're lying down, you quite often have a mask on, especially at the moment with the pandemic. The dentist will have a mask on as well. You can't see their face, which can feel really upsetting. You can't read whether that person is a threat. You can't speak because your mouth is open. You might also be in pain. Nobody likes a dentist anyway. You've got the noise of the drill. You don't know what's happening. And I think all of this has really been heightened by the pandemic because practitioners are talking to patients, but they're using a mask. So they can't see their face. They can't read their facial expressions. Whether we're conscious of it or not, we obviously look at people's facial expressions and assess whether they're a threat or not. And also the mask might be muffling speech, so we might not be able to fully hear or understand what's happening. So not that we can do too much to avoid that in this current situation, but it's just something to be aware of and to ask the practitioner to slowly repeat what they said and to have the confidence to do that as well. But yes, dentists, physios, and smear tests is one which obviously very understandable. But that's one of the ones I think I'm personally most concerned about, because I know that if you attend, it's really important and it can prevent a much serious illness of cancer later on, and it's very easily treatable and preventable if you do attend your smear test. But if you miss them repeatedly, then you could become very seriously ill, and obviously we don't want that at all. So it's really important that we can reach those people as well, I think. Yeah, and so Claudia, can you tell us a little bit about how we've adapted this campaign for the pandemic?
Yes, absolutely. So the Survivors Trust has quite a long history of providing training workshops to various people and organisations. And obviously in the pandemic, we've had to bring those workshops online. So to support this particular training campaign, we're planning on running a few virtual workshops again, because face-to-face contact is so important when we're discussing matters like this. But we're also supporting that with a social media campaign. We've been working with an animator to produce a short animation summarising the main takeaway messages that we want practitioners to get from the campaign. And as part of that, we'll be producing some resource packs that are tailored to individual practitioners as well. Yeah,
we'd really like to get some, and hear from multiple practitioners as well, and make the resources profession specific. Obviously, we can't reach every NHS staff member, and we recognise it's one of the largest employers in the world. But we really want to reach as many different professions within the NHS as possible. So we really want to work with people who work there. So do please get in touch, and we want to make this as multi-agency as possible. We also really want to hear from survivors who have had any experience, good or bad, when they're attending their medical appointments for this very reason. And I think as well, it's also really important to educate the public on this issue as well, because I think a lot of people just say, oh, and not only was she abused, but she's also ill all the time, and they really don't get the link. And it's so common that we hear survivors have ongoing health problems for the rest of their life, and that's part of the reason that it is just so traumatic of what they experience. So yeah, thank you. Okay, we'll go over to some questions now. Kate, can you hear us?
Yeah, that's great. So yeah, we've had some really nice questions from our listeners. So the first one just wants to highlight that this is a really interesting topic you've raised, and sort of thank you for the work you're doing. And they were just wondering, have you noticed any differences in the confidence levels or concerns about disclosure between providers from different healthcare specialties?
Ooh, that's really interesting.
I think a lot of people who have engaged with us at this stage in the project have been from safeguarding teams and have had a background of being health visitors or nurses, and have shown a real interest in the topic. I think that is a really interesting question. You know, most of the people we've spoken to have said that they and their immediate colleagues are very much aware of these issues, but that the wider trusts in other areas may not be.
Absolutely. I think as well, what we've really learned is that how the safeguarding teams, how they've joined us because they know of this issue and they're really struggling with it themselves. I mean, obviously we're constantly in a bit of a funding battle, aren't we? And I think they're all working so hard, dealing with live referrals now as well. But I think they're increasingly becoming aware of the issue that this affects non-recent abuse as well. So kind of expanding that knowledge base as well. So we're not just thinking about an immediate safeguarding referral, we're thinking a little bit more about the trauma impact. We've heard a lot from practitioners as well, saying that they'd really like it included in the student curriculum for trainees. So that's something that we'll work with the NHS on. And it's really important, and that came up in the King's College research as well, that training midwives, because they're not trained in this when they're studying to become midwives. So yeah, I think as Claudia said, though, anyone who's engaging in this project, and it's quite often the case, they've already had experience of its difficulties. I think this is always the problem that we find when discussing sexual assault, is that actually the only people that engage with it are people who have experienced it themselves, or are working with someone who's experienced it, or know somebody who's experienced it. And for us to really change the culture on that, we need to get to people who don't understand it as well, because we need to change these numbers, that 1 in 6 people have been sexually assaulted, 1 in 4 people will have been abused at some point in their life, and that's just too many. So we need to work to change that.
Yeah, that's brilliant. Thanks. Another question we've had in is in terms of sort of who you're targeting, sort of is there a specific reason you're looking at just sort of healthcare professionals, or would there be plans to extend this to wider organisations as well?
It would be lovely to extend it to wider organisations ultimately, but this is an NHS specific project, and it's funded and monitored by NHS London. So for the moment, this is looking at healthcare and the very specific issue that survivors have of having additional healthcare needs and needing additional healthcare appointments throughout their life. We're obviously aware that survivors also are much more likely to come into contact with other authorities as well, such as social services and the police, and need additional support in education as well. So we're aware that all of those institutions can all do with conversations like this, and it's so important to have them. But for the moment, this is specific to healthcare.
Okay, brilliant. And another question, in terms of sort of little differences that sort of healthcare providers can make, is there any sort of advice or tips for healthcare professionals about making appointments easier for survivors?
Yeah, I think this is something that we really want to get across, is that we're not asking people to completely change the way we work. These are just little things that many practitioners are doing day in, day out, but it's being consistent with them and applying them to every patient you face. So part of trauma-informed healthcare is assuming that anyone you come across may be a survivor of trauma or abuse, and treating them as such without pressuring them to disclose. So just, you know, taking a little bit more time with people, making sure that you're having eye contact with them, explaining every step of the procedure before and as it happens, and empowering the patient to let them know that they can stop at any time. These are all really simple things that can make a huge difference. For some procedures as well, such as smear tests, it may help to let the patient know they can keep on certain items of clothing, such as socks or skirts. And being aware of those little things that might help someone feel more comfortable can just make a world of difference.
Absolutely. I think just explaining the procedure before it happens is just the key. And I think so many practitioners do that, but just sometimes might just forget. And I think, you know, as Claudia's saying as well, explaining it while you're fully clothed. If it's a procedure where you need to take any clothing off, explain it while you're fully clothed so that you're not in that vulnerable position first. I think that's our key message as well.
I think a lot of patients, survivors or not survivors, may, you know, especially in these times, feel like they don't want to put the NHS under more pressure, and they might feel anxious about going to their appointments because they realise it might take them longer. They might be scared about sort of having to stop in the middle. So just reassuring people that, you know, it's their health that they're taking charge of. And it's the practitioner's job to help them, and, you know, just putting things into perspective a bit can be really helpful as well.
Yeah, definitely.
Yeah, that's brilliant. Thank you, guys. I've just had a really interesting comment come in. This listener was just wondering whether the campaign will be approached with an intersectional lens. So, sort of, for example, survivors, especially the sort of those from marginalised communities, their experiences with sort of oppression in the community often overlaps with their experience of sexual violence, and it can be the two of these and bias which can affect sort of going to healthcare providers and the impact of the support they're getting there. I just wondered if this had been sort of considered in the campaign and if there's sort of scope for that.
I think definitely. I think there's the whole campaign has lots of areas that it can focus on. Different cultures, different practices is certainly one of them, because I absolutely agree. That's a really key area. And obviously with disclosure, like Claudia said earlier, we found that a lot of practitioners are worried about if there is a disclosure, even if it's recent or non-recent, because they don't want to say the wrong thing. So it's not that they don't want to hear it, it's just they want to get it right. And we know that for some cultures and practices that disclosure is considered such an awful thing to do. We live in an environment where we victim blame. Inherently, we all do it. We're sort of trained to do it, and that's the way society is set up, which is what is called so damaging. I think people are very nervous about disclosing because they feel somehow it's their fault, and then any questions after that can sometimes be misframed to imply that too, which is what can be so damaging. I think there is so much room for working with different communities to change the messaging and make sure that we're including everybody. And so, yeah, I mean, we have really big ambitions for this project. We would love to do that. We'd love to make it unique to each practitioner, and would love to roll it out nationwide and have posters in every hospital and every clinic. And to also, oh, sorry, I can just see someone here as well has said about working with receptionists, and the first point of contact that you make when you contact the NHS is so important. If you're nervous about making that appointment and you pick up the phone and you get through to someone and you say, actually, I'm a bit anxious, can I have a chaperone? And that receptionist isn't quite as understanding as maybe they could be, or ask the wrong questions, and that can completely put the person off as well. So yeah, we'd love to get to all those people. I think as well that however well prepared you are, if somebody asks you something when you're in that moment, even though you had in your mind you were going to say this, you're quite often stumped and just don't respond in the way you thought you would, and you beat yourself up about it afterwards. And that's something we'd really like to change as well. Something we're considering piloting, which we'd really love to hear people's opinion of from both practitioners and survivors, is if maybe you went into a clinic and you picked up a token, so you didn't even have to use the words, and that token indicated that you were a sexual abuse survivor and that you were a bit anxious about this appointment. You could just put it on the table. Obviously, it's got needs a lot of thinking out, but we're wondering if something like that might be of benefit. We know that for domestic violence victims, you can go to if you end up in A&E, or you can go to the chemist and you can ask for a name. I think there's one at the moment which is Ask for Annie, which alerts the person that you are at risk of domestic violence and lets them get help without everybody hearing and understanding. So I wonder if we could do something like that, and would love to hear from people if they think that's a good idea. I'm conscious we've gone over time, but we did start late. So if there's any more questions, I think if people have to go, thank you so much for joining us. But otherwise, I think we'll just stay on for a few minutes more and finish our questions.
Okay, brilliant. Yeah, and I mean, any that we don't get to as well, we can sort of share answers on social media, and sort of, feel free to email us with questions as well. The other query we've had is in terms of sort of time frame. Sort of when is this campaign being run, and sort of the areas as well. You've mentioned London. Sort of is there a specific reason London's been chosen to trial, or?
Do you want to take that, Claudia?
Yeah, so we're planning to launch the training campaign early summer this year, and it's due to run until the end of the year. But we're really hoping that, you know, as people start engaging with us more on this, it will snowball and, as we mentioned, spread further than London. The reason why it's currently focused in London is there are so many NHS trusts there, and the project is being funded partially by NHS London. So, but as we say, we are hopeful that it will snowball and reach other areas of the country as well.
Absolutely.
Yeah, that's brilliant. Do we want to do another question, or are we conscious of the time?
Should we do one more and then?
Yeah. So I suppose just from both of you, what are your sort of overall aims, and sort of what are you really hoping to see from this campaign, even if it's your idealistic view?
When I started it, I was like, well, just deliver a bit of training locally, and actually it's something I've been really passionate about for a long time, working in the sector for 15 years now, mainly because just the survivors I meet I really are plagued with ongoing health concerns, and it's just such an additional trauma to the trauma they're already dealing with. So to make that easier for them is something that I've been really passionate about. And I think, I mean, my hopes for it can be huge. As we've said, it covers so many areas. Like someone said, you know, institutional racism, different cultures, working with boys and men who have been abused, working with women who have been abused. And if we can start breaking down a better understanding among both survivors themselves and practitioners, then ultimately it's all working to change the culture in society around how we view sexual abuse, which we need to do. I mean, when I started this 15 years ago, the figures are the same as they are today. So even though we're definitely talking about this subject a lot more and publicly, we're still not changing the figures. There's still as many people being abused as there were 15 years ago, if not more. And so I'm really, really excited that NHS are working with us to change this, and that we are now starting to have these really important conversations in individual institutions, because that's how we're going to make life better for people who have experienced sexual abuse, which will stay with them for the rest of their lives. But it doesn't mean that they can't live their life to the full. It just means they might need more support to do so. Claudia, what about you?
Yeah, I think it's just still such a massive taboo subject in every aspect of society, and you know, to really make a difference, there needs to be a huge culture shift within the NHS and wider. And I mean, it's so difficult to, you know, shift the culture of your own organisation, let alone another one as big as the NHS. But if we can get people talking, if we can get people feeling more confident and being more aware of the rate at which they will be encountering survivors, hopefully that will, just being aware of that fact will make them a little bit more, you know, receptive to how people are feeling, and just to treat survivors with a little bit more kindness and give them the time they need to look after their health.
Definitely. I think the thing that's been the most exciting about it so far is just the response we've had from NHS practitioners. I mean, we have people join us on the focus groups, and they're working, they're in the wards, they're in the call centres in the background, but that's how much they care about this subject. And it was so heartening to have so many different practitioners join us. We've had people email us, we've had people doing research in this area email us and get in touch. We've had survivors already get in touch and say they want to take part. Like, across the board, people realise this is a conversation that needs to be had. And we're so excited to hear from practitioners who are doing this right now. They're doing what we're trying to do, and to hear from them and get their expertise, and know that even when they're so busy in this crisis, that they're seeing the trauma that so many survivors are experiencing, and wanting to have this conversation is really heartwarming and really exciting to know that we can really make a difference with this campaign.
Yeah, no, that's brilliant, guys. I mean, I can't wait to see all your plans sort of roll out. Just as excited as you lot. I suppose sort of if anyone's got any further questions or sort of wants to know more about the campaign or anything, obviously we're going to be sharing loads of information across social media, and the closer we get to launch date, there'll be more information coming. But if anyone sort of has any specific questions, feel free to email info@thesurvivorstrust.org, and we can get back to you there.
Thank you. And we'll be replaying this later on, won't we, Kate?
Yeah, we've recorded it. So yeah, it'll be sort of shared either on our website or on social media.
Great. Okay, thanks so much, everyone. Thanks for joining us. Please do stay in touch, and we'll keep you informed as we look to launch in the summer.
Thank you, everyone.
Thanks. Bye.
Thank you. Bye.